today I will just share with you the agenda. Hopefully, we will try to, if it works, yes, we'll try to make the most out of this opportunity to speak. I'm sorry that we are missing actually few people that were meant to support also today, because a lot of discussion have been done also on the side, and I would have loved to continue the discussion. So I hope they will join during the meeting. In any case, we had did our welcome, so that's super. Now we're going to have two speakers, Naomi and Virginia. We'll introduce them later. And we will follow up with the discussion, talking about really what they shared with us. Remember that today the focus is boosting success. So how do we boost the success of in the fertility journey? And then we would like to discuss a potential tech solution that has been initially discussed with Aider, really in the beginning, when we start making like our thinking around what could have been a tech outcome from this journey. And in the beginning, I thought to create like a breakup rooms, but I think we can do it all together in one room now. And then we will probably ending the session. So I will continue then with our first speaker, which is Naomi Thielen. She is the senior manager in a value-based healthcare cluster in the Netherlands for Ferring. And she is really a true activist in improving patient outcome in the fertility journey. So Naomi, stage is yours.
Okay.
Yes,
I was moving too quickly, I think. I'm sorry that I can't share my video. I don't know why, but today it just stopped working. So you have to do, I think, with a picture for me, who was in the invitation, I think. But yes, thanks for this invitation. As Marcia said, I'm a value-based healthcare manager at Ferring, the Netherlands, Germany. In 2015, the Dutch affiliate chose to go in the direction of value-based healthcare. And I'm not sure whether you are familiar with the concept value-based healthcare. I did not really make slides about that. So maybe I can just introduce it to you with my slide deck. So then I am going to share my screen. If it works properly, then you can see my screen. Slideshow. Do you see my screen? Okay, thanks. I can speak mostly for the Netherlands and Germany since a while. Maybe it's good to say that Ferring, at least in the Netherlands, said we don't want to only provide medication, but we also would like to help the field to improve the outcomes of the medication. So to make sure that we get the best out of it. So in terms of boost of success, how can we boost the success of our medication? And that value-based healthcare is a concept which is in that direction, meaning getting the best out of any treatment. So it's more broad than only drugs, but it's also, other kinds of treatment, focusing on what is the value for the patient, which means, and you see that here in the middle of the screen, value for the patient is health outcomes. So what the outcome is of the treatment compared to costs, with the note that the outcomes, better outcomes is more important than lower costs. Here you see on the right side, accessibility between brackets. That is because in the Dutch situation, accessibility of healthcare is not really an issue. So it's not a factor which really has impact on that value. But we can see that if you look at, the best outcomes for patients compared to costs, so high patient value is valuable for any stakeholder. It is for the medical specialist, it is for the hospital, it is for the insurer, of course, because they get more results for the treatments they pay for. Our Ministry of Health is focusing on this subject. And of course, for patients, it's also relevant. The better outcomes for the treatment, the better chance of, for example, a healthy baby in terms of fertility. Yeah. And actually, Vering said that is where we want to go. Vering Netherlands said that, and Vering Germany is joining us on this. And well, maybe even more more clusters in Vering Europe will go into that direction. But mainly focusing on how can we improve the outcomes of the care which is given with the medication we provide. Please feel free to ask questions if you would like to. This is the value-based healthcare thinking, and that's also actually supported by the doctor's opinion. So what you see here is how the doctors see that we have to change the Dutch healthcare to improve, going from volume to quality, instead of treating as much patients as possible or doing as much as possible to a patient, going to what's the quality for the patient. Transparency, well, you can read it, but you can see that really a change in thinking is going in the direction of more quality and more to the outcomes than only to production and costs. And in the let me use my laser pointer. Here in the lower part, you also see a better application of e-health and m-health, mobile health. And well, we can all say, I think that the past 1.5 years has did some work on that. So mobile health and digital health is also increasing. And that's one of the direction Vering also has chosen to use in the thinking of value-based healthcare, because it's also about proving that you improve care. And if you want to prove that the solution you provide to improve the outcomes really does improve that outcomes, you have to collect data. And if you want to collect data easily, then it's most useful to use digital solutions, because that's a sort of natural, efficient way of collecting data to prove what you're doing with your solution and how it really improves or changes the outcomes and how you can prove patient value. If I can then go back to how it all started, it's a line which, well, as I said, started in 2015. What I want to visualize actually with this timeline is that a very important part is here in the beginning. That's actually where it starts. So collecting patient information, a patient focus group that really provides insight in what is valuable, what's important for them, what did they miss in their patient, in their treatment, in their journey. And then, of course, also verifying that input with the doctor's opinion on what they should see as could be improved in the patient journey or in how they provide care. And that's actually that combination of getting patient input and checking that with the medical specialists is very important. We really build a think tank, as you can see here in orange. And that's a group of gynecologists which are very close to us. We see them twice a year. We really reflect with them on our ideas and on our solutions to make sure that it also fits the clinical practice. And that's an open, constructive way of checking what you're developing really works with the field. And that's this is really in our backbone, as you can say, for the Dutch team.
No, I'm sorry. I have a question actually for you. In this think tank, do you have a mix between professionals and patients, or is it just professional?
This is only professionals.
Okay.
That's also because they are more open in their feedback if there are no patients. And on the other side, if there are no patients, are more open if you ask them directly than when when a healthcare professional is also there. Okay. So you get more honest feedback. So
you don't, let's say, you keep them separate in order not, let's say, to avoid filters in their feedback.
Exactly. Yeah.
Okay.
Yeah. What we do is really to build a structure in which everyone can say what they think without any reluctance or any feel of shame or whatsoever.
Okay, thank you.
So if you look then at our patient focus group, this is where we started, and well, after having quite some conversations, we could take out a few of the learnings patients gave. One is they really want to have one team in which they know the team members and that they see the same people every time again, instead of swapping a doctor and having a new face every time they're back in the fertility clinic. They want personal attention, of course. That's you want to be spoken to as you and not as a patient. That's one of the topics. Also, transparency and correctness of information. There is a lot of information on the internet. Well, we've seen it in the past years too. There's a lot of information, but you don't know what to trust anymore at a certain point. And that's also for these patients. They want to know what is really reliable information, where can I work on, and what is bullshit. And if they get information on all kinds of topics around pregnancy and fertility, and they get that from their doctor, then they can trust it. Then they really feel that it's something which is reliable. So that would give them peace and trust. And of course, efficiency in the care path is another thing. Sometimes they have to go 3 times a week to the fertility clinic, which is of course time consuming. They have a job in general. They don't want to share their problem with their job. So then going too often to a clinic is not in their best interest. So this is what we got from the feedback from the patients. And as I said, we have the think tank, and we mirrored that. We asked the think tank what they think about this. This is just to give an idea how it works with our think tank. There are names in it of different clinics in the Netherlands, and you see they really show as our think tank. They are willing to be on a picture and be visible as our experts, actually. To be honest, they are proud of what we built in the past few years. So they really also want to shine with this, because they really feel that our solution, or the solution we have, is their idea. They made it. They really bought it. They really share it with the patients. And well, there's no better partner in this than someone who really is feeling as a co-owner of the idea.
And Naomi, this My Ferty Coach, is it like a virtual coach that use their, let's say, I mean, what is it exactly?
Shall I show that later on at a certain point?
Sure.
Is that an idea? Yeah. Okay. But I'll show that just to give you an impression. It gives a view on what we did, I think. So this is our think tank. And with the think tank and the patient input, we actually said there is a good match between what patients are looking for and what the think tank is looking for, what fertility doctors would like to see. And that is transparent information about lifestyle. On the left side in the dark blue, you see how the doctors were reacting and what their issue is, what their problem is actually. They have to send patients back home if they want to start treatment because patients are still smoking or because they're overweight and too much overweight, so that it really has impact on their chance of success of a fertility treatment. That's one of their problems, and then they lose the patient, at least that's how they feel it. But they also want to support the patient in that change of lifestyle in order to increase their chance of success of the treatment. They really feel a sort of they have a two-sided thinking on this. They want to help the patient, but they also want to make sure that the patient makes the improvement because it really helps in the outcome of the treatment. On the other hand, patients do want to lose weight, for example, or they are stressed. So they also want to have that support because they don't know where to find transparent information. But often they say, I really would like to do myself all I can do to increase the chance of a treatment because, well, the eagerness for a child is really big. So you also want to do whatever you can do, but they don't know what to do because they don't know what is transparent and right information. So that's really the combination. And if you can make sure that that lifestyle information is personalized, then it also feels as they get personal attention, although it's not directly from the doctor, but it's for them. So it's made for them and provided by the doctor. That are important, feelings which work in this idea. So we said we want to build something that gives transparent lifestyle information. Why did we choose for lifestyle? I think that's also something which is valuable to know. There are quite some aspects in our daily life which have impact on our fertility. It is weight, it is our food habits, eating habits, but it's also our physical activity. Is it too much or too little? Folic acid, I think most of you know, but it's of course also one of the things. But also smoking, drinking, caffeine, and alcohol and drugs, and stress have impact on fertility. I would like to give a little insight on that, just to give you an idea about what also the scientific background is of why we are doing this. Here you see a graph in which the number of lifestyle variables is increasing. So this is zero lifestyle, bad habits, negative habits, compared to 5 or more. And here you on the y-axis you see the time to pregnancy. So the time it takes to get pregnant, and then you see that if you have no negative lifestyle variables, it takes 3.5 months approximately. But you can also see that the range is really increasing if you have more lifestyle variables which are not positive, which are not helping. And the difference between three months or 2 years is of course very impactful. So if you can, then the question rises, if you change this, would that have effect? Or is it something else that is, making the problem bigger? To show you one of the things, half of the Dutch population, and I think it's in other countries almost similar, has a weight above a BMI of 25, which means that's a certain matter of overweight. So there is weight is one of the things which has quite a lot of patients who go to a fertility clinic do have overweight because it's 50% of the population. And here you see, for example, how the curve of a chance of success of pregnancy is relating to the body mass index. So it's going down, even if you're too skinny. Sounds not very nice, but it's friendly meant. But also, if you have overweight, it really decreases your chance of a pregnancy. And that is something which you might be able to do something yourself. Also, sperm quality is negatively impacted by overweight. And you see, of course, I think most of you know that the risk of pregnancy, diabetes, but also having the child prematurely is of higher chance if you have overweight. So there are quite some negative effects of your lifestyle or on your pregnancy and the healthiness of your pregnancy. So there were 2 big programs, scientific programs in the Netherlands on these intervention. And well, this is one of them, slimmer zwanger, translated as smarter pregnant, which has proven that if you improve your lifestyle, then it has effect on your chance of a healthy pregnancy. And there's another one, which is a lifestyle study focusing on women with a BMI above 29, where they also changed the lifestyle, so they lost weight, and the chance of success of the group who lost weight after treatment was higher, and they had less fertility treatments. You can say, well, that's mostly not what you want as a fertility medication manufacturer, but it means that the effect of what you do is bigger. So you can help more patients with the same amount of treatment. So if you then there's a last one, stress. There's a study in which mindfulness is used as an intervention intervention for stress in the fertility journey. And what you can see is that the group that did mindfulness had a higher success chance of having a successful IVF first cycle. So also reducing stress. So it also proves that if there's stress and you intervene on that, then you can get a higher chance of a successful treatment. So if you summarize that, then you could say that if you do certain lifestyle interventions on subfertile couples, so both the woman as the male partner, then you can get more spontaneous pregnancies, less fertility treatments, and of course, less complications, or also less complications for mother and child. And if you see that, you can think, well, does that then also mean cost saving? It is already a higher outcome, so it is at least it gives the you can calculate that there's a higher success rate, but you can also calculate that there are cost savings because there's less needed for the same success ratio. So if you then summarize this all, you can see that there's a benefit for all of the stakeholders. We summarize the stakeholders here, but if we could do this, that's actually what we were thinking of. If we could do this, how can we make sure that everyone benefits? Well, that's here in the slide. I'm not going into detail of every one of them, but at least it has a benefit for each. So yeah, then you can hardly say, I'm not going to do this and make the next step. So I would like to now explain a little bit more about what we then developed based on this information. And actually we said we want to have an app, a lifestyle app for the patient, but also connect them with their fertility center to make to help both worlds, being the patient who feels supported by the fertility clinic, and the fertility clinic being able to monitor the patient and provide potentially additional support, or see at least what's happening to the patient, and sometimes give them a little, how shall I say that, thumbs up or something like that. Let me have a look. In summary, it means that My FertiCoach is an online coaching system with an app and a dashboard on lifestyle. Here I summarize the lifestyle factors. Can you see that? Because for me, okay, great. For me, the pictures are above it, so that's it's not visible for me. But it's about a healthy weight, healthy nutrition, and healthy exercise. Stop smoking, stop alcohol and drugs, and also reducing stress. It is meant to motivate, so really on a positive thinking. Motivational interviewing is a way of helping people to convince themselves actually to make changes. So positive activation, you can call it. It is a way of supporting the couples and being able to follow them with the dashboard. And as I said before, with data, you can prove that you really do something that has impact. So we measure and we collect data finally to provide, of course, a scientific basis for the impact of my Ferti coach. On the right side here, you see Sophie. We call her Sophie. It's our chatbot, our virtual coach, actually. And she is in the app and calls you with your name and calls you also your partner with his or her name. And well, really makes it more that you'll feel connected with a person in the app. And now I'm going to try to show this video. But if you don't hear the noise, the talking, then please let me know. Let's have a look. Does it work? Oh, it doesn't work, does it? No. Next slide already. Oh, that's a pity. Oh, it did something, but I didn't hear anything. Where is it? Come on.
Maybe you need to maybe take off the the pointer.
Yeah, that's
because it could be that is like interfering.
It's possible. So now it's off.
Oh. Yeah, now you can.
Do you hear anything? It's not running yet.
Try to leave it like that. Oh no, it's blocked.
Okay, that's a pity. No, it doesn't work. It was we have an animated movie to show how it works and what's in it, but it's more appealing than when I tell it. That's why I wanted to share it. But it's not a big issue if you don't see the movie. So we can go on to the next slide. So how does the app work? It's a sort of diary in which you can do 5 things every day. Or at least 4, and well, really it takes you every day to support you with your lifestyle change. So there's information in it, messages which you get a few times a week about healthy food, for example, depending on the types of lifestyle change you want to take. It asks you every day, for example, whether you have eaten fruit or whether you have been out for a walk or cycling or something like that. So that lifestyle behavior. A lot of patients also said that they really like to share their thoughts and their feelings, well, on a regular basis without someone really having to react on it. So we said, well, it's also possible to share your feelings in the app. Just put in how you feel and with a note on it, and then it's just a way. Then you can leave it there. There's a relax break, which is of course also for the stress factor. One of the apps, the functionalities, I would say. Questionnaires are the part in which, how shall I say that? I forgot to tell. If you start with the app, you first get questionnaires. And with the questionnaires, the doctor can see how your lifestyle behavior is. So you can see your BMI, you can see how you eat, how much you exercise, whether you smoke or drink alcohol, all that kind of question, but also how you feel. So how you feel about your fertility issue and whether you feel being really on your own or that you have support for your family or from your partner, more the emotional quality of life questionnaires. That's what you get in the beginning. And if you have then answered all the questions, together with the doctor, you decide on which lifestyle support is valuable for you. So then you choose a few one with which the app will help you. There's also a way to ask questions to the doctor about lifestyle. That's this last one.
And do you connect with other couples or patients that are going through the same, that are targeting the same goal and therefore are tackling their lifestyle actively or not?
We have had discussions about that and decided up to now to not introduce that functionality. And it is nice to get to know other people with the same issue, and then you can share your issues or your feelings. But we said on a privacy point of view, it's difficult. And it requires a lot to build such a thing, but there is really a need for that. Yeah, how shall I say that in English? Yeah, the lotgenotencontact, so contacting other people with the same issue. Yeah.
Yeah, because I saw an app that is called Noom, that is mainly for like changing lifestyles and getting active and lose weight or change your habits in terms of food. Mm-hmm. And a big portion of the success of this app is that you have a group coach. So you have a coach that basically keep writing to you and try to keep you motivated. But on the other hand, you have a group coach that basically group people with a similar profile. Mm-hmm. And basically, he, let's say, foster discussion within the group. And in this way, sharing the pain, sharing and the trip, it should help in achieving, the change in the habit. And this app is only in, the language is not English. It's local language only.
It's Dutch, yeah. Up to now, we are working with German team for a German version for the German market, and for the Dutch market there will be an English version. I think somewhere next year.
Right.
And then also the information, and then the app is really in English, but apps are how shall I say that, regional. So it's only in the App Store for the Netherlands at this moment. And you need to be invited for the app by your fertility center. So it's really a connection between you and the fertility center.
Right.
So not everyone can just download it and play around with it, because we said to her, we really want to have it for people who are committed also to work with it. It is not 100% of the patients who are committed to, although they are, of course, registered by their fertility center, but still, quite a big group we are sometimes surprised about the success and the retention rate in there. Let me have a look. This movie, I'm curious whether it will work now, is without sound, so that's easier. But it gives an impression. No, movies are not working in Zoom with my computer. I'm sorry about that. Yeah. But I think it gives an idea about what it looks like. At least this picture gives an idea about what it looks like. What can I have a look? Yeah, I think that is all I wanted to tell you. Next to that, Netherlands has already quite a track record on, value-based healthcare solutions that improve care. So my IBD coach is a Dutch invention, to say, my fertility coach, but also for the patients who had our growth hormone. We build an app to relax, because giving the injections is a stressful situation every evening again for the families, not only the patient, but for the parents and for the brothers and sisters. So it's really a yoga app, which whom you can, if you use it for a month, you can build up from a mouse to an elephant and feel really getting stronger in having your medication in an easy way and a relaxed way. That's what I wanted to share.
Thanks so much. Really, really interesting. And I'm a big fan of coaching, so I see that. And I assume you got already results, right? following the data that you showed, were you able already like to have results for the treatment that are linked to Ferring portfolio, let's say, and the Ferring fertility path? Did you already like saw an improvement in the outcomes?
That is difficult because, well, in general, in the Dutch situation, it takes 2 years to get pregnant if you after you enter the fertility center for the first time. So we don't have that outcomes yet. So the real outcomes you want to have. But what we see is that quite a big group of the patient is really losing weight in the months they use the app. And there are also a lot of patients who decrease their smoking habit. So they decrease the smoking. So that are sort of in between points, measure points, to say that it has effect. Patients are also really daily coming back. Not all the patients, but quite a big group is coming daily, uses the app daily. So in that case, you can say, well, at least that are good indications that in the end it will also work. But that's something we want to research, of course. So that's because we collect the data, also the data about pregnancy and the data about the health of the baby when it is born. We in the end can prove that there is a connection, hopefully successful impact of the app, but that's what we want to do at least. And the data is there, is available at least. Yeah.
Sure. Okay, thank you. Does anybody else has questions? Okay.
Now there may be a comment. Value-based healthcare is something, is a trend that we will see many more countries coming up to, especially when they will see the challenges of their healthcare system. They will also basically they will ask for the real world data and the approach of putting that patient in the center. So yeah, it's good that companies are doing it. It's good that the system and the healthcare system is actually also pushing for it. And I think that's, if you look in Europe, Europe has many examples of that. Yeah.
Well, thanks.
Yeah, absolutely.
I stop sharing.
Okay, so now we will go for our next speaker for today. So I will introduce Virginia. Okay, so our next speaker is Virginia Franco. She is a medical doctor, a gynecologist, and obstetrician. She is the Chief Executive Officer and co-founder of Uni Solution Company. Virginia, the stage is yours.
Hello, Marzia. Hello, everyone. Is the audio okay for you there?
Perfect. Perfect. Thank you.
So we spoke, me and you, Marzia, I think it was on Friday, and I decided to elaborate a presentation of the company, but very in the inspiration for the creation of the company, why we started with the company, literally the inspiration as we acquired. So I modify a little bit my standard presentation. I'm happy to share here with you guys. Let me just open it. Is it okay to see there? Yeah. So as Marzia presented me, I'm a gynecologist. I'm working with vaginal microbiome researchers in the fertility field. So Uni Solutions is a company that is focused on screening vaginal microbiome with high performance and letting quantitative measurement help in the infertility treatments. Just a second. I will speak a little bit about us. The inspiration to create the company, the ideas, why this public, why vaginal microbiome. So it was around 2019. I was working in the Department Hospital of Gynecology, Public Hospital of Gynecology in Brazil. And I work with different, all different types of patients, the obstetrician care, Department of Fertility, and patients in the primary care, woman primary care. And there, inside of this department, it was a group of research around vaginal microbiome and recurrent candidiasis, the link between vaginal microbiome and recurrent candidiasis. And I started collecting the samples with them, sending to analysis. And inside of the same department, I was wondering what could be the importance of vaginal microbiome in fertility, in recurrent candidiasis, in vaginal infections. And another sector of the same department hospital worked with endometrial biopsy for fertility treatments and vaginal microbiome for fertility treatments. And but a lot of ideas that they had was rely on biopsy, always on biopsy endometrial, and so on with different technology. And then I had I started wondering how we can mix how we can link vaginal microbiome with fertility treatments and the important role of vaginal microbiome in the fertility field and in vitro fertilization procedures. So that's the inspiration for the project. And after researching and reading and discussing with colleagues of the department and from private clinics, the conclusion is always that the vaginal microbiome influences, but its function in assisted reproductive technology is still unknown. So we need more researchers. Vaginal microbiome is an explored world. Nobody knows much about that until nowadays. The most important publications started 2012, so it's a bit blind word already. It's still a blind word, and the current methods has possible limitations. So what is the problem? Why we choose this public? Why Ioni solution works with in vitro fertilization and fertility field? Because we know that fertility treatments, they are expensive. They all over the world. They have they still have low success rates. They take time for women. They are stressful. They take a lot of cycles of in vitro fertilization until they get the success. The tests that we have now in the market to screen vaginal microbiome and endometrial microbiome, it's expensive. They are expensive. They rely on biopsy. They they are qualitative measurement. They don't have those levels of accuracy. So again, the public, the numbers, patient under in vitro fertilization, it's a growing population. Women are getting pregnant older due to their lifestyle, to their careers, to their business. And 500,000 is the number of in vitro fertilization only in Europe, only in 2014. 2 billion euros is the total cost in failure procedures. 4 cycles is generally required, and 7,000 average cost per cycle. Why we started linking vaginal microbiome with fertility, with the success rates of in vitro fertilization. And this is, I wanna, after starting talking about those slides, those data have been reported, but not yet demonstrated. But we believe that those reports justify further research. So we started the relationship between the vaginal microbiome and the probability of a successful in vitro fertilization have been reviewed and changed in the past few years. So this is a graphic of Ioni solutions. The graphic is illustrative. It's what would be, in a simple word, a protective environment for vaginal microbiome in the fertility field in a non-protective environment. Some data, some researchers confirms what we suspect. They believe that the protective environment consists in an environment rich in lactobacillus, but not only as a level of species. We need to understand which lactobacillus, which levels of each one, and the link between them, and the non-protective environment. What would it be? Another Lactobacillus ginseng, for example, more than 35% could be unprotected, and Gardnerellas with proteobacteria more unprotected than only Gardnerella in levels more than 28%. So this is not only a matter of identifying the bacteria, but also a matter of identifying the levels and the relation between them, those levels. Here, for example, we have numerous examples of bacteria that we could mention in the presentation, but I choose it, for example, Chlamydia trachomatis. Chlamydia trachomatis is one of the most important bacteria, sexually transmitted, importantly linked to tubal infertility, because this bacteria, it is 3 to 4 times more prevalent than Neisseria gonorrhea, and it is it's commonly related to tubal infertility because it destructs the ciliatic epithelium, which is an irreversible process. So it's tubal infertility, it's indication of in vitro fertilization. So for example, woman that has one episode, some articles that we reviewed pointed that woman that has at least one episode of Chlamydia trachomatis infection in their life has up to 11% of infertility rate. After the second Chlamydia trachomatis infection, those numbers can increase up to 23% of infertility rates. The third, 40, so it's a huge number. And again, another reason to study the microbiome and the link with infertility is that the immunity, the antibody and the immunity system, for example, again, in chlamydia, the IgG anti-Chlamydia trachomatis is prevalent in 68% in women with infertility. And we have the same example in Prevotella. We have the same example, even more clear in Gardnerella, that I will not get in details here, but that modifies those immunity marks, increases the inflammatory process, and increase the levels of infertility as well. And Chlamydia trachomatis, allow me to mention that this is it's commonly related to asymptomatic infection. So we don't know, even unless you have a good screening test with the levels of it and the prevalence of it. And there are no fast ways of identifying causative agent. So what's the problem with that? In the case of bacterial infections, broad-spectrum antibiotics are used whilst waiting for the identification of the pathogen. What does it mean? The treatment delay, the non-responsive, the recurrent infections increase, wasted resources, and the most important problem nowadays, bacterial resistance. The products that are already in the market to screen vaginal and endometrial microbiome has the biopsy as an important component and also are still expensive. Is it possible to work with a specific target analysis in the vaginal microbiome? The answer is yes, with potential benefits. If you have the opportunity to establish your own target analysis, you have the opportunity to develop your own assay. Which means that, according to the literature revision, you can evaluate the bacteria that you already consider important. You can choose which bacteria you will include in your assay. The prevalence of some groups, some bacteria are prevalent on women with poor infertility outcome. You choose it and you find it. Subclinical patients, what do I mean? There are patients that don't have symptomatology, but with a positive qualitative test for routinely screening. So you quantify it and link it to the appearance of symptoms, and you justify why are you treating that patient. You can evaluate recent treated disease, you can avoid the overuse of antibiotics, evaluate patients that respond or not respond for treatment, and possibility to create and improve probiotics that already exist. This is not applicable only for fertility. This is applicable for vaginal infections in general, the gynecology field in general, not only reproductive. The limits of existing technologies. If we compare bacteria cultures, you take the sample, place it in culture. You wait for bacteria to grow, and it can take several days. You look at it, and as a phenotypic point of view, it is identical. So you don't necessarily know if you have a confusion of identification. The next generation sequencing, it's numbers of false positives, false negatives, and the mediocre performance with increased complexity. In the case of mass spectrometry, I don't have a personal experience with that. but according to what I read, I need a specialized technician to monitor the data and to monitor the procedure. And finally, we get to what we want, what Yoni Solutions propose to do as a solution for the fertility field. How can we connect that and establish the potential link between vitro fertilization and vaginal microbiome? We propose to use advanced testing for genetic composition to screen vaginal microbiome and identify the prevalence of same groups of bacteria in a quantitative measurement. It means that you choose the bacteria, you complete your assay design with the bacteria you know it's relevant, and you quantify your measurement. You give quantitative data to the doctor in charge. So ATGC, advanced testing for genetic composition, you collect the sample directly from the patients, and no pre-treatment is needed. Preferentially, the patient has to avoid sexual intercourse for the last 3 days. Second step, DNA, extract total DNA. Then you run the PCR where you amplify multiple targets in the PCR. So because of that, you need a small DNA variants to be separated. And this is thanks to their physical properties. And this is when you use cycling temperature capillary electrophoresis. Otherwise, you have a normal PCR draw and you don't know what you identify. So after that, to be more quantitative, to be more accurate, you need to do CTCE analysis. And then you quantify results based on a quantitative profile of the pathogen. This is the big benefit of the technology. The unique selling proposition is a quantitative measurement with strain level information, not only in level of gender. So it improves with complexity. So it doesn't matter how many bacteria you want to analyze, you can do that. You only have to choose and develop your assay. And we develop your assay. I developed here a small roadmap just with the latest milestones of the company, very summed up, because I think that just the more relevant milestones. We establish a partnering in co-development with the company REM Analytics, with research and development, so they can run the analysis for us. The first 34 vaginal samples from the Optodo Shuv were used from patients from the Shuv were used to calibrate and validate our process. We collect the first results under those samples, and we could present them in the conferences and congresses. This is the Point of Care Diagnostic Congress in Davos, and the other one is the European Congress of the Society European Congress of Gynecology that we presented last week. And we could present those results of those first samples in order to improve the analysis development, to evaluate market opportunity for the company, to discuss with the doctors, to collect feedback again, and to start developing a clinical research. So that was quite a milestone for us. I will not get deep in details in that, and I mean, we can always discuss this. I'm happy to discuss, but here for the presentation, I separated a draw of a map of bacteria. What I mean here is the following. What is the process to develop those analyses? You have to define your target bacteria, you choose your target analysis, and you map them. So we have literally a map of bacteria. Imagine that each node here, can you see my pointer? Yeah, I think so. Each node here is a genetic sequencing. So each node here is a bacteria, a microorganism. Each line here is a genetic, each distance from them is a genetic distance. So what this technology do in order to achieve a quantitative measurement is a dilution series. They choose a reference of bacteria. We receive those bacteria and they are our reference bacteria, and you distribute it in different wheels where you mix it with your reference. And what you here are the graphics with some bacteria that we find that. But basically what we do is a dilution series, and at the end you have a graphic with your level of bacteria related to your reference. So you have a quantitative measurement. Those data they belong to REM Analytics. They don't belong only to us. So I'm happy to share with any one of you that want to have more details of the function of the technology. But this is what I separated for this presentation. Otherwise, we will speak for 40 minutes. And this is not the objective here. So I will quickly present part of my team. Me as a gynecologist and medical director and co-founder of the company. Vincent Keller is our co-founder, business development strategy. Paulo works as our CTO. So each one of you with our different backgrounds and support the project, which would be quite difficult for us without each one of our members with their expertise and experiences. So I have a big thank you to give to my team here, and a big thank you to you from Tech4Eva for the support and for your time once again in this presentation. Thank you very much.
Thanks to you, Virginia. It's super interesting. And I love the topic of microbiome in general, because I think it's a hot topic that is rising more and more. I'm coming from another field, which is oral care. And again, microbiome is, something that is central in the discussion now. And funny enough, when you look into like a baby mouth, their primary microbiome is actually the one from the mother. So it's, it's all connected. And it's fascinating to see, that you are now like investigating more and more the link between success and the local microbiome. So I assume that you, from what I understood, you identified also what are like pro success balance in the microbiome, right?
Exactly. It's difficult to measure. I think one of the questions that people most ask is, how do you know the components that really have the influence? This is something that we don't know yet. We don't have exactly the answer, but we have now tools to achieve, to improve those answers. And I think, especially during the Congress last week, there are some resources that doctors are using, but they don't change a little bit, don't change too much the results. They started using some tools to endometrial microbiome since 5 years ago with not much relevant differences. So they were quite interested in what we are doing, because now we have the possibility to quantify those bacteria and decide if it's really relevant to treat or not. Otherwise, you will give antibiotics to everybody. So that's it. I think the big milestone for us this year was to present that we have now the possibility to establish what is the potential microbiome that is good for the fertility treatments, especially for in vitro fertilization. And this is not easy. Yesterday in Tech4Eva, it was Marco speaking with us at the end of it. And we consider, I speak very fast with him, considering the variants that we have, the importance of establishing groups of inclusion, exclusion groups. And this is so difficult because it's endless world. But now with a quantifying measurement, I do believe that it turns our life a little bit easier. At least 50% of the path is done with that. So I am more confident.
Yeah, I also, maybe, it's just my opinion, but like thinking of the impact of inflammation in general, also connecting to what Naomi was explaining before. So everything connects to inflammation. If the existing microbiome get disbalanced and of course getting an impact on inflammation, again, you get into stress and of course you have an impact. So that's probably one of the first steps that you will be probably able to show.
Yes, we have to. Now, the difficulty of the project is exactly to define what are the variants, the most relevant variants that we should include in the first clinical trial. And at the same time, we will not, we can we have to establish the window of opportunity to collect vaginal microbiome sample, because again, it varies depending on the day of the cycle. So imagine the draw that we are trying to develop to achieve that. And the biggest challenge that we have now, it's not only that, but to run the regulatory pathway. And I spoke to some colleagues that also are doing medical device and medical consultants products, and it's for a startup, it's too difficult to have the best clinical trial with investment for that, with a good conclusion that people really understand what you are doing. It's quite challenging to make people understand what you are doing, the relevance of your results, and at the same time you have to run the regulation. So yeah.
No, makes absolutely sense.
Yeah.
But Virginia, I assume that you, I know a group that is in Harvard that is highly involved in microbiome. Do you have collaboration with this type of groups that work specifically on microbiome?
I have the collaboration of REM Analytics, a company here in Switzerland that do analysis, those target analysis for us. And I spoke to other companies that do the same analysis before taking my decision, but I don't have the support of any foundation yet. I know there are some foundations all over the world that support specifically vaginal microbiome analysis, but microbiome analysis in general. Yeah. But I still don't have the support of any of that, and this is one thing that I'm trying to achieve.
It's a good step. It's a good step forward because it's central. And microbiome is truly a field not so investigated, but so important because we have so many bacteria that live with us, symbiotic, and they're happy until a moment where everything gets messed up. And then they create a lot of chaos and problems and affect either our hormonal levels and, of course, fertility. So, congratulations for taking this path because it's super complicated, but it will be extremely rewarding once you crack it because it will help so many, couples that are willing to become parents in having, an extra help. And an extra.
Exactly. And that was one of the reasons that I came to speak with Fertility a couple of weeks ago, because we know some companies, some large companies that work with microbiome fertility. So we need support to run this clinical trio part and at the same time the regulatory part. So.
Right. And you said you talked with Ferring.
Yeah, I spoke with Ferringi. I presented not the latest milestones that we have, but with a group of Ferringi I spoke, and that's it. And that we are happy with the latest news that we have.
Right.
With those presentations, the feedbacks. It was important for us.
Okay, and it's a pity we lost Heider, which is representing, a lot from the innovation side of Ferring, but I'm sure he will see the recording because he is definitely a good contact. Okay, anybody has of the one that stayed has a question?
I wanted only to comment from a patient standpoint, so very ignorant in terms of these scientific concepts, that it sounds very interesting also because when you undergo to a fertility plan and treatment, you have to do so many exams. Some of the exams, since we have also to undergo swabs, could be taken with additional purposes. So, for example, the analysis of the microbiome. So, for the patient standpoint, and this is the view I can bring, probably we could achieve more insights and results just keeping the number of exams as they are now. And I believe that also this type of investigation is very important because I recently read a book about the influence of the bacteria in the gut that they are also influencing our attitude. So from experiments on rats with different microbiome in their gut, they have different behaviors. So I believe that's a very interesting path and a study.
Yes, and taking the opportunity that you mentioned, the gut microbiome, I spoke to a doctor that is developing a research with gut microbiome and polycystic ovarian syndrome. So the relation, because it's one of the causes of infertility, it's an anovulatory syndrome. So they are working the gut microbiome modifications in the polycystic ovulatory syndrome, which is quite common in the population in general. So yeah, it's our as Marco said yesterday, is our second brain. And why not to study it and especially improve the tools that we already have? Because unfortunately, we can see that it doesn't work. You have a lot of bacteria, a lot of draws of bacteria, and what do you do with that? You give antibiotic to everybody? Of course not. It doesn't make sense. So you have nothing to do what we have until now. So I am total 100% in favor of improving the tools to measure the microbiome, and you use it somehow with the pharmaceutical companies, with the doctors directing their clinics, but without, especially if you can avoid biopsy, as that's what we are trying to do, if you can avoid invasive tests and accurate results. I think that's the right direction, and I'm confident that we will get better results.
Yeah, thank you. And anybody else that has questions?
Thank you.
No, okay. So I think that actually also like what you said, Elisa, was interesting because again, it remarks the fact that there is a new word that will gravitate around the microbiome, and the effect on our body, on our behavior, on our stress level, except inflammation level, etc., are so tremendous that knowing more about it will be probably, let's say, change the way that every single aspect of health will be treated. And I also believe that this will be pushing us a step forward into tailored medicine, because every single person has a different mix in terms of microbiome. We can have trends, but we establish a symbiotic life with them that is really unique. And this shows that people should be probably analyzed as an individual rather than in a bulk when thinking of treatment. And especially thinking of the fertility journey, this could have a tremendous impact. So I think that this specific solution that you are proposing, Virginia, will have a tremendous impact. And also, I really believe that what Naomi was explaining before in changing lifestyle, which again are unique to the person, will show in the long run a great impact. Although overall, also summarizing what we discussed in the previous focus group, we should be able somehow to prevent a situation to prevent to arrive there and at the end of the fertility journey. So awareness still is something super important to be tackled at the early stage of any person that has ability to reproduce, reproductive ability, let's say. And on the other hand, the support, empathic support, psychological support during the journey is extremely important. From the moment where a woman is made aware that could be that she will have a fertility issue to the moment where she will decide to engage into IVF, for example. So those were like the highlights from the previous meeting. Now, thank you so much, really, to both you and Naomi,
for the opportunity. Thank you,
and Naomi for sharing your experience. One of the last things that we wanted to discuss today, and I'm very, very sorry. Usually, I would have used Miro board to do this, but unfortunately, I don't know why I cannot access my board. So, technology. Today, the technology really, left me alone. But the good thing is that we are just 6 left over. So I think we can tackle it as a discussion. Basically, I want to just share with you a little bit of thinking about potential solutions that could boost success. And during the last few months, in Beside Focus Group, there has been a lot of conversation done one-to-one with the participants about what could have been a significant innovation from technology perspective that could have helped in boosting success. And one of the things that was highlighted with different angles, but always it came back, is the fact that does not exist a platform online where all the data coming from, the data from patient, data from research, data from big research done both in university and in big company or startups, go inside in an anonymous way and get analyzed by artificial intelligence in order to provide potential successful protocols. So I would like to know what you think about that, and also what do you think could be limitations around these, let's say, these ideas. So
and maybe if I can, because I remember this conversation where we talked together on this. So I have to say I've been trying to connect ecosystem with the industry for the last 10 years in many different ways. And if you're a startup out there, usually a big pharmaceutical company could, or even any company could be quite slow and can take you time, and you are looking for a commercial contract to basically have something tangible to get going and produce value through that commercial contract. If you don't have a commercial contract, what is valuable in that ecosystem is also the data we produce. And we are, surprisingly, everyone has data and they don't know what to do with it. So if you look at the data in a pharmaceutical company, there are tons of data. It's super regulated, but there are quite a lot of critical evidence that would be awesome to share to a hospital, a university hospital, to do the research and so on. And I think there is a willingness nowadays for the management of those companies to really think of the impact those data that were collected across the years could have if the right researchers or data scientists can look into it. And same on the other side, you guys in the depending on who you are in the startup world, but you might have consumer data, might have physiological data, and those data could be gathered the right way. So I'm looking at this in a way that why don't we have the highways to connect each other, those organizations in the ecosystem? Why don't we have that, and how will it be looking like if we can? And what will be the right business model to make sure that self-ecosystem can be sustainable? So there is ethical discussion, of course, but you also have to create value for the ecosystem itself to self-sustain the growth of that impact. So that's kind of where my thinking, and I don't know if someone can interject, but I'd love to understand if this is something that is interesting for the community or not.
Paolo, go.
Yes, hello.
Hi,
everyone. I do have I think it would be very interesting for the community. However, I'm sorry to highlight a few issues that I see, more as a how can we fix the issue than as a they cannot be fixed type of approach. The first one is regulation. So if you're a company and you've spent millions of dollars to run a clinical study, this is your asset. Sharing it is like sharing your bank account. So either you can get money for that, or it's going to be very difficult for people to share that. The second problem is anonymity. Being a mathematician, I can tell you, if you give me a curated database that is perfectly anonymous, but where I have 6 degrees of freedom, I can find everyone in there. So add any meaningful data that you're going to provide me in that it allows me to do any sort of statistics, is going to allow me to find every single individual, maybe not every single one. If someone's called Joe Smith and fits the perfect norm, I might have some issues finding him. And
if we need a detective, you will be a good one.
Not a detective.
To have.
Not really, honestly. Anyone can do that. Any really serious data company can do that for you.
Sure.
Any serious statistician or hacker or IT guy can do that for you. So the moment you open this up, you're opening a whole can of worms, in that none of the data of your anonymous data is going to be anonymous, actually.
This is an ethical problem, because I believe that the privacy law doesn't forbid that. So they only say the data should be anonymous, but then they don't pay attention to the consequences, at least in Italy, from what I know. But there is both a technical issue and ethical issue. So if you're allowed, do you want to do it or not?
Yeah, I think it's also like probably okay, let's speak in the ideal world where, you know, no money are involved, probably like overcoming let's say the anonymity and making things anonymous and finding a way to make them anonymous, and let's say working out the ethical part and the privacy part. Then let's say the community, the entire community, people, human will benefit from it, right? The big issue is overcome the economical part. And then I have a question for you, Alex. Either, I mean, you come from the company standpoint, for example, and actually one of the beginner of this idea is actually yourself. So I want to understand how you deal with this, because it's against to say that
we did interestingly, this idea started with a program we sponsored with Nokia Health. Nokia had a fantastic database of through their, you know, the IoT devices, you know, and we had a drug that was struggling to demonstrate the impact in real life of sleep disorder in a working life population. We were scratching our head with the medical team saying, how can we demonstrate that this is an issue? People are waking up at night because they have bladder issue, and we don't have proof that they have. I mean, it was not sufficient to just do a clinical trial. We wanted to have like to showcase to the doctors that this was existing. This was a problem in society. And then we were scratching our head like this, and we said, yeah, let's look at IoT companies. Maybe there are like data on sleeping pad or whatever. And in our research, we fall into this company that would then came back to be WeThings in Paris, but they were basically before Nokia Health. So when we did the contract with them, they were Nokia Health. And we approached those guys. We said, you know what? We just want to do a retrospective study. And these are the data points we'd like to have. Do you have a structured way to look at your data? And they opened. They said, okay, let's sign NDAs, and let's make sure you don't have the data, like it's anonymized and so on, like it's compliant. And we said, yeah, we just want to make sure that we can publish, like in the literature, that there are issues in that population. And they showed us, if I remember, I mean, it's public. It's, if you go on Ferring Nokia Health scientific publication on Google, you'll find it. And we had like 180,000 people in the database that were eligible for the retrospective study. And we did a program with them when we said, okay, let's retrospectively analyze the data points to prove the endpoints that we wanted to make. And let's also continue prospectively with the ongoing campaign that those guys could do to qualify if we can actually justify that endpoint. And this is where I said, hold on a second, all those years, Ferring had like issues with this point. Those guys had the data all along. And it seems that it was two people talking on the phone that created the connection. That is not normal. So that kind of is my dream will be that there is a software development kit, an SDK in the tech world, right? An API, whatever. There is something that is standardized that I can say, Ferrin has, for once and for all, a standard of how you can access anonymized data for the purpose of doing good science. So that kind of is, and I can tell you my management is up for it. It's to answer your point. Even if this is the bread and butter of a company, to innovate right now, you need an ecosystem. You cannot, it's too slow. We have not enough data scientists in our company to tackle those problems. And the war of talents are elsewhere, around the company is quite tough. So that's where it came from. I said to myself, if we really want to make it happen and scale the impact, we need something like this. So I know it exists in the financial sector, in the fintech sector. You have acquiring bank that have protocols to share your credit card information between every bank. So the data get transported and transformed in a standard. So I'm asking all of you, why is the financial industry, which was also going through a big transformation 20 years ago, is now able to transport financial data anonymized to prove that this credit card has not been stolen, for example? And why can't we process that data somehow for scientific purposes? And that's kind of where the discussion started.
I think that Paolo wants to comment.
Yeah, go ahead.
Sorry, thank you.
And I might
be
wrong. I'll challenge Paolo if you want.
I'm not going to challenge, actually. I'm going to come A, with an answer for the financial sector, B, with a possible solution for the medtech sector.
Yeah.
Great.
So first of all, I think the main reason why it is possible to do in the financial sector is because the data is very poor. Poor in the sense that it is extremely limited. We can all agree in 5 minutes, even if we ask a financier or a politician, what is the information a credit card should contain? Maybe not a politician, but any reasonable people will agree on the set of data that you need to include on a credit card transaction. Yeah. If you're going to run a clinical trial, you will never be able to agree on exactly what is the data that you need. You will need to compromise. You will have a panel of experts. If you are a big corporation like Ferrin, you will have a process to define the data that you need, and to fine tune it among the hundreds of millions of variables. You need to choose 30. If you choose more than 30, you will probably not be able to walk out to sort yourself out of it. So there can be no standard data, because the day you have a standardized data, you are dead. The research is over.
Yeah. No, I see your point. But you see also mine. So
I also see yours. And that is where I come up with a potential solution. I think there is a way to solve the problem, to transfer only the main information needed for the research and not the actual data.
Okay.
And how would you do that?
How to say it?
Sorry, no.
I have a software for it. I have a system for that. Huh?
Yes, we can hear you.
Okay, yeah, I'm in the car now, so I wanted to make sure that my microphone was working. I would like to react on that, because I know that this topic is, how shall I say that? It's a power thing. It is not only from the pharmaceutical companies, but also academic centers are, as we call it, sitting on their data, protecting it from anyone to have a look at it. So such a thing as a data exchange system or data share system, as you can call it, is a topic which is on the desk of medical directors, CEOs, CEOs of academic centers, of academic associations. So this is really, well, how shall I say that? Not only a privacy thing, but even a power thing. And that makes it a very difficult question to solve, because it has to be, well, as you said already, there are quite a lot of different types of data. There are a lot of different measurement units. It is so diverse and it is so protected that it really is something which has a certain level to get progress on. I know that in the Netherlands there are collaborations, for example, starting collaborations on oncology data, which is of course a big subject, in which there's a lot of money, but still it is not going very quickly. So yeah, I don't want to be rude, but really, this is a big thing to say.
So yeah, so no, I think you're right, and I see it from the EU side. I'm sitting at the on one of the commission that is working on establishing that EU healthcare data space, and we've been working for the last 2 years on defining what will be the rule of transporting, transforming, and adapting data for cross communication within the EU. So I see already, let's say, governments aligning on protocols, and if some people are interested, I have slides from the EU Commission that are showing that next April 22 it will be voted, hopefully that first version of it, and what it's still like coming from the regulator. And interestingly, my experience with Nokia Health, but I did one with WOM. WOM was part of Tech4Eva, and we had the same exchange of information with WOM on 500 women for thick data and 1 million women on big data. And we've done retrospective and prospective analysis on it. So I found it fascinating that we have big tech companies, startups, university hospitals, and industry players that could find a good business model to collaborate together for the sake of better science and better patient outcome. Usually what is blocking us in those conversations is the solution that can create this middleware. This is where we struggled, to be honest. We wanted in one of our projects to build, for example, an algorithm to calculate chances of pregnancy from a pharynx perspective. We wanted to, based on all the data and the experience we have, can we calculate chances of pregnancy based on a series of factors? And the problem was not the accumulation of data, was how technically can we distribute that algorithm to all that ecosystem so that ecosystem can use it, because if this is only one company using that might be a bit lame, right? So then we face this problem that, yeah, impossible. There is no way it will be an ad hoc discussion with everyone, and that is just too big. And I come back to your point. Yeah, it's just too big of a project. So I see now in the diabetes community, for example, companies like Medtronic, who have more a engineering, I would say, DNA. I can see them more and more connecting, for example, those glucometers together, so that the glucometers have the same standard, and that you can now use a Philips glucometer, Sanofi one, whatever. You see, so I start to see those activities in the healthcare system as well, and also in the industry side, getting better at connecting and making the data interoperable. My next question is, how can we take it further for a pharmaceutical company? And that is where, yeah, it's still exploratory.
Probably is a model that ideally should be applied in all the healthcare sector, right? So, Paolo.
We've actually built a preliminary software to do exactly that.
Okay.
So, and we're actually going to roll it out. Our first main customer is actually sitting here today with us, who is going to be using it as part of their own application in order to consolidate data across several points of collections. And even if they cannot directly access the data that are being collected by their different customers on themselves, how to still aggregate the various information in order to grow your own pool of evidence. So
you have this software for Virginia? No.
Yes.
Okay.
That's
connecting.
You got it. You got it. So we're providing.
There were not many.
connecting the dots.
It's quite easy.
Nice,
I
okay.
invited him on purpose. I invited him.
That is good. I
I
mean,
said, jump in this conversation. It will be good. Have you there?
no, we are happy that you joined actually, because having a data scientist is key, because the idea behind is to have a data scientist afterwards able to, transform those information into viable product through algorithm or artificial intelligence or whatever. Yeah, what do you want to say?
Even better if you don't need a data science. Then the data scientist actually did their job well, is when you don't need to hire one yourself.
Yeah, that's a good point. I actually like that very much. Yeah.
Makes sense. Yes. But what intrigued me is that really this discussion, thinking it could be even taken, further up to general health, and going for having this, let's say, put as a compulsory to share from all companies, for the benefit of humanity. That would be, utopia, but maybe, good. I mean, Elisa is from an orthopedic company, so it's another sector. And again, I assume that having access to data that are also coming from, general research or other company research, not sensitive. I mean, also probably there are things that can lead to a patent that maybe you want to keep before you develop the patent, but afterwards, I mean, sharing.
I think the mistake we do all the time is try to find a simple solution to a very complex ecosystem. So we might need a very holistic program that fit all the stakeholder problems that are very different when you look at their lens, and that's why we keep creating complexity, because we come up. Depending on who you talk to, everyone is tempted to create a simple solution for the government, a simple solution for pharma, a simple solution for the startup. And at the end of the day, when you take a step back, it's very much like a patchwork of simple solution that got complicated when you look at them together. So looking at it from the regulator perspective, they are saying you know what? We need a protocol, and some companies want to work together. The private and public sector wants to work together. How can we make it happen? And I like that concept very much, where tomorrow, if you look at R&D pipeline getting challenged, because we know that the value of innovation will come from non-drug related services. So that those non-drug related services will be fueled with data that will have a change of behavior impact in a therapeutic area like fertility. So how can we harvest and make sure that this data is not siloed and stay within one player? So that kind of is where I don't have an answer. I know that there is an appetite for it. I know that if there are a couple of companies doing it, showcasing the way, especially market leader in therapeutic area, it's unlock a lot of potential for an ecosystem to play within. Yeah.
Paolo, you wanted to say something? You're on mute.
Sorry, I'm mute. Sorry.
I know what is. I mean, talk when you want.
Yeah, I know, but I'm in my office, so there's people around, and people are still working. But I think there are two things. The first one is, I think it's not 100% ready, but we're going to roll over with Virginia as our first customer, our IT solution for data integration. So if you're interested in having a look, when you come and visit Virginia, you can drop by us as well.
I don't know if he's going to visit me. I have to invite him.
Oh, okay. Well, up to you then.
I'm just kidding. Hi, they're more than invited to visit us.
The second thing is, I think there's an alternative to complexity. If you build something that's too complex, it's probably not going to work. But the alternative to complexity is abstraction. If you abstract more, you can have a simple solution that encompasses more things. And that's been our way of coding. And our way of building everything is to just escalate the degree of abstraction. And for me, one of the greatest examples of abstraction is I'm currently going through getting ISO certified. these ISO norms are a great example of abstraction. With simple concepts and about 30 pages, they can describe a norm that is applicable across a huge and extremely diverse scope. Why? Because they're abstract enough, they're simple, the execution might become complicated, but the norm itself remains simple. And this is a little bit what we need to try and build, is to increase the level of abstraction of how we see the solution if we are to have something that is simple, but at the same time tackles a complex problem. Because if you try to do something complex to tackle a complex problem, usually that blows up.
No, but this is I said it in a provocative way too.
Yeah, absolutely, yeah.
But no, I like what you're saying. I like where you're going. I think you're right. I think as you hear, I'm trying to paint the picture that right now there's an explosion of solutions, which is not the solution either. For every company, for every department, for every employee of a company, there is a solution nowadays. And it's not fair for a woman trying to conceive with her, partner to have 20,000 apps on her phone and go through that, right? So that kind of is the idea of saying, maybe, just maybe, there is a way to create a good experience that has a nice outcome for the clinical practice, the patient, and the payer as well, if they are in the background, but also that there is a sustainable system behind the scene that can sustain the production and the life cycle of those solutions for the long run. And I'm not believing that we need to wait a big tech company to come up and find a solution to fix everything for the industry. And I really don't believe that this will happen. We shouldn't wait for the tech messiah to come and say, okay, now finish to play, pharma, and me, big tech, I will give you the solution, right? I'm like 100% sure almost that this will never be the case. So there is a card to play. I don't know which one, but I know that there are baby steps, and this data interoperability model is one of them. That's I can sense here. Okay. So that's your kid, Malia, yeah?
Yeah, sorry, just 1 second, because there is a
so no,
crisis moment.
I can give you what I feel from a startup perspective. We see a lot of startups that are very good in the execution, like you were mentioning, but then the valuation is stressed because they don't have clinical evidence. They lack that kind of pharma feel or pharma, approach of the scientific acumen that needs to bring a bit more. So they're a bit too much techish or consumeration. They need a little bit that scientific literature. So some of them are discovering that yes, it's a world ruled by scientists for scientists, and sometimes it's not a good thing, but that's the way it is sometimes as well. We would like to be a bit more consumer friendly. We know that the patient is also a human being. So looking at someone who is trying to conceive just through the eye of they are trying to conceive and they are not a human in general, that's also wrong. So understanding that someone maybe has interest in some other area in his consumer life and so on, that is also creating a pattern for a company to build a better customer experience or better services. Because I can tell you some industries out there will see that the turn to becoming a service company is also pretty near. So you cannot just manufacture pills all your life. You have to do below the pill, above the pill, before the pill, after the pill, whatever you name it. But you have to become a service company at the end of the day. So that kind of is where that data component. I always say internally, what if you are a brake company and you never talk to the guy who is using your brakes, right? It's always BMW or Mercedes or Toyota selling your stuff. So if you paint that vision to a pharmaceutical leader and you tell him, do you want to be the brake or do you want to be the car manufacturer? They will always tell you, I want to be the car. I am the car. My name is on the product, right? And if you play with the ego. But if you look at the other side, you can very much become, because you have this whole regulated business, you can easily become the tiny bit of element that works in the system, and no one sees you. And worse, you don't even have a feedback loop of what's good or not good for your product usage. So that's kind of is where that data music is coming as maybe a good feedback loop of having that vision, that maybe blurry vision, but at least a vision of what it should be looking like.
Yeah, I think like the patient-centered approach is, has been demonstrated that it works. But in any case, I love this discussion because I think health has been the most live discussion we had since the beginning. So thanks so much, for participating. And maybe it would be worth it to do an hackathon on this because it seems that there are ways to make it happen, although there are many angles that has to be tackled. But like having, different experts joining from, regulatory perspective, privacy perspective, and, data scientists and scientists in general from companies and from academia getting together maybe could help in creating a complex but simple solution.
Abstracted.
Yeah, I love this abstracted thing. It's really
right.
Yeah, it's really different. Okay, so I think that for our series of focus group for the fertility journey, this is coming to an end. We are going to have an event on the 7th of December where all the focus group will get together, and this will be running a PFL. I assume that you guys will attend for sure, either representing Ferring. As you know, Ferring was one of the sponsors of this fertility journey with the Tech4Eva project. And of course, there's going to be like a group mutual in this case, together with the Innovation Park, leading the event on the 7th of December. We're going to have a poster there featuring what were the main points discovered during the different focus group and the action that were proposed. And from what I understood from Xenia, which wrote, she was joining the first part of the meeting. Unfortunately, she had an emergency with her daughter, so she had to jump out. But what she was telling me is that they're thinking already how to do the following up to the Tech4Eva and each focus group for next year. So let's see how this will evolve. But for sure, there were many insights that can be used and, and take and move forward. So for today, I really would like to thank Virginia and Noemi for their sharing, their experience and their journey, let's say, working wise, thinking of fertility. Of course, Elisa for sharing again our the patient point of view. You, Paolo, for interacting, giving us a lot of insights from data perspective. And of course, Aider is my teammate in this journey, so I cannot say thank enough. Beside this, although they are not in the call because they had to leave earlier, I really would like to thank Simone and Julie because they have been, on the background orchestrating all the groups and all of the meetings, and a big thank you also goes to them. So I don't know if you don't have any more comments. I think I will adjourn our meeting today, and thank you really a lot for your help.
Thank you, Marta, for the opportunity.
You're welcome.
Showing our results and our progresses. Thank you very much.
Yeah, stay in touch. Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Bye. Bye-bye.